On the Health Watch tonight, for all the advancements our country has made in healthcare, one constant remains. American men, on average, die years earlier than women.
And as Fox 61's Tim Lammers reports, Hartford Healthcare is trying to address the problem by helping men help themselves.
There are a lot of reasons that men tend to die earlier than women. For one, we're more likely to smoke, do drugs, die in accidents and car crashes. We're more likely to kill ourselves and to be killed. And just as important, maybe more important, an old adage also seems to be true. Boy, we hate going to the doctor.
And we know men take less care of themselves. They utilize healthcare visits, preventative visits, and even the emergency department less often.
I guess men just try to tough it up and sort of ignore, wait until the problem really hits them.
And by then, many times it's too late. But in one specific area, it's often not too late. And that just happens to be the one area where men do tend to go see the doctor.
Men come in for erectile dysfunction. Men don't like to come into the doctor, but they want things to work in the bedroom. That's where they're willing to come in.
So, urologist Dr. Jared Bieniek is often the first specialist to see patients who come to the Tallwood Men's Health Center in Farmington. But he's often not the last.
Trouble with erections can often be a heralding sign that there's issues with blood flow.
When that kicks in, what data has shown, it's about 4 to 5 years down the line they end up having an event like a heart attack.
So at Tallwood, Dr. Bieniek can easily send a patient right down the hall to see preventative cardiologist Dr. Wasim Chowdhury, or to an endocrinologist if the problem is hormone-based, or a behavioral health specialist if it's stress-based.
It's very interrelated. Everybody, all the specialties like endocrine, bariatric surgery, cardiology, urology, nutrition, we are all under the same roofs and we all communicate.
I'm able to walk down the hall and talk to the other specialists about a patient, or we send a message through our electronic medical record to really discuss patients in more depth.
And to get patients talking as well. And if they're not chatty, an in-depth, age-specific questionnaire sometimes catches problems that would go unmentioned. The whole center is built to make men at ease talking about their health.
We just try to make everything clean, classic, and a comfortable experience. You don't walk into the exam room, and exactly as you mentioned, there's not diagrams of male genital organs on the wall or pamphlets that are falling on your head.
I'm Tim Lammers. We'll see you tomorrow when we're all local, all morning on the Fox 61 Morning News.